Well, good evening, Burlington. It is Friday night, and of course that means our weekly front porch clap. I hope you are participating in that. Every single Friday night we do the front porch clap. I am Marianne Mead Ward, the mayor of the city of Burlington, and welcome to Burlington Matters. Our show looks a little different today than usual because of COVID-19. We are filming remotely via Skype, so a new experiment for all of us and for you, but it allows us to still bring you some information and have our awesome guests, as we do every show, to talk to you about what's on your mind. And today we have with us Dr. Dale Kalina, who's the Medical Director of Infectious Diseases at Joseph Brant Hospital with us. We have the President and CEO of the hospital, Joseph Brant Hospital, Eric Vandewall, is also with us. And I know from the town halls that we've done and some of the questions that I've gotten from the community really in the past month since we've been dealing with this global pandemic right here in Burlington, that a lot of your questions have centered around health matters and how you can keep your community and your family and yourself healthy and safe. So I know we're going to be talking about that on the show. And so let's get to it. The first thing I guess I'll ask, and I'll turn it over to you, Dale, first, is what the status of the hospital is. What can you tell us about there was an outbreak that was declared recently. How's that going? How many staff have been impacted? How many patients are there? And, just what's happening at our hospital right now.
Thanks, Mayor. And thank you for having me today. I'm very happy to be here and to be able to chat with everybody about everything that we're doing at Joe Brant, but everything that we're doing to help keep the community safe as well. To answer your question, so at the hospital right now, you're right, we have declared an outbreak on some of the inpatient wards. Now, to be very clear, the outbreak itself was declared because we could see some evidence of transmission of the virus inside the hospital itself. And it really underscores the importance of wearing appropriate personal protective equipment and making sure that we're participating in the safest practices possible. Now, there's three inpatient wards that are actually on outbreak right now, two of which are closed to new admissions of patients. So there's actually 18 staff that have been affected overall, and 4 patients as part of the outbreak. Now, the fortunate thing is that one of the wards hasn't had to close to any new admissions. A second ward will actually be able to open soon because of the duration of the outbreak itself, and we'll be back to very nearly normal operations across the hospital soon. But keeping in mind as well that it's actually just a small portion of the hospital that's on outbreak. So the remainder of the hospital, namely the intensive care unit and the emergency departments, are completely unaffected by that outbreak.
That's great to hear. And the staff that are infected, they are not working in the hospital. They go home.
No, not at all. So the staff that have been unfortunately affected from the outbreak have not been working at all, regardless of whether they're symptomatic or not. So from the outset, when the staff were tested, and we had over 400 staff who were tested as part of the outbreak, not a single one who is positive has been working regardless of symptoms. So we'll be coming up on the 14-day period that they have to recover and to make sure that they're safe and not able to transmit the virus. That period will be coming up soon, but none of them have returned to work yet. They're all recovering at home.
That's great. I want to turn to you now, Eric, to talk about the pandemic response unit, to talk about the readiness for the hospital should there be a surge. So where is that at right now?
Thank you very much, Mayor Mead Ward, and again, thank you for having me here with you this evening. Joseph Brant Hospital has a pandemic plan that we have been implementing over the course actually of the past 6 weeks. And so it's a graduated plan that begins with measures such as active screening of patients, visitors, and staff, and then also starting to reduce the occupancy in the hospital. And so that's culminated with beginning with reducing elective clinics, eliminating elective surgeries. And so that was all to create capacity in the hospital. And so today we're at about 64% occupancy. We've been as low as 50%. And so that was to create essentially space for COVID positive patients should they present and require our care. We also have a surge plan. And so our plan for creating capacity was not only within the four walls of the hospital, we also planned and created the pandemic response unit, which provides up to 89 additional beds to care for COVID positive patients. We felt it was important to ensure that we were as prepared as possible to serve the residents of Burlington and area. The modeling that we had and data that we had reviewed at the time of the decision to create this surge plan suggested that we were going to need well over double the occupancy that we currently have in terms of bed capacity. So hence we created the pandemic response unit to increase our capacity to ensure that we could care for patients.
So has that unit had to open yet for healthcare for patients?
No, not yet. We are still using the capacity within the building. We are actively training staff and physicians in the pandemic response unit in terms of emergency code procedures, et cetera, working through our workflows to ensure that when we do have to open the unit at some point, that the teams are ready to go. That's
great. I did want to talk about the numbers that we've seen recently, not only province-wide, but in Burlington, that we had some fairly good news earlier this week around the idea that we may have hit the peak, and it was nowhere near what we thought or expected, which is good news. The measures that we are taking collectively as government and as individual residents and as healthcare providers seems to be slowing the spread. It's still spreading. I think that's an important message to reiterate, that we haven't stopped this thing. But what does that peak mean for healthcare? Are we expecting a second surge? What can you tell us about, are we going to start to see cases declining? Doctor, what does it all mean to have that peak?
Yeah, I think you've asked a number of very good questions, and you're very right to say we did and have been starting to get more and more good news, especially over the course of this week. And you're right to say that the Chief Medical Officer of Health for Ontario announced earlier this week that we were likely seeing the peak right now. Now that's based on, yes, a lot of models and everything that we've been seeing over the course of the past several months, and also the rate of increase of the new cases that we're seeing every day. Now, when we're talking about that peak, the peak that the Medical Officer of Health was referring to was the maximum number of daily new cases that we're seeing. So it's important to recognize that although the peak may be right now, in the days to come, we're still going to be seeing quite a lot of new patients every day. And although that number of new patients is on the decrease, it's still a lot of new patients. So as an example, yesterday rather, we've been seeing around 500, a little bit in excess of 500 new patients a day. And that would mean that in the days to come, as we start to go back down to numbers in the 400s, for instance, that's good news, but it's still 400 new patients every day across the province that we're seeing and are here to take care of. So although we're seeing that peak of new patients every day, the other peak, our peak surge capacity or our peak surge of patients, is another thing that we as hospitals and healthcare providers look at as well. Because the number of new patients, while remaining high, they need that care, and we need to be able to provide that capacity. So as Eric mentioned about expanding our capacity at the hospital and with the PRU, that's exactly what we prepare for, is that peak surge. So that peak of patients that we need to care for. Now, the second part of your question, so here in Halton region, it looks, based on some of the data, that we may have in fact peaked last week, which is, again, great news. It means that the number of new cases that we're seeing every day is getting to be lesser and lesser. I believe over the course of the past 72 hours or so, the number of new cases that we've been seeing is actually in the single digits, which is excellent news. It means that as of the 19th, which is the latest data that we have available by a public health bulletin, it means that in Burlington, we've actually only had 86 cases, which again is great news, especially when compared with how many people we were preparing for. Burlington, as an interesting point, of the 4 municipalities within Halton Region, actually has the lowest number of patients. We've been doing a lot of testing, and we've been making sure that we've been prepared, but we're all in it together in terms of a region. But we're actually not seeing as many people as we had been worried about. And at the end of the day, I think that that's testament to not only your hard work, Mayor, and driving around with the megaphone, if I'm not mistaken.
The Mayor Mobile and the megaphone, yes.
But it's a testament to all of the hard work that everybody has been putting into that social distancing to really help us out of the hospital. And we see everybody and are very thankful for the thanking everybody on Friday evenings. And it's really that extra work that everybody's putting in on a day-to-day basis that's helped us so much in the hospitals.
No, that's great. And you know, it's one of those things. I'm sure you're getting it. I know, Eric, you're getting it at the hospital, and the question around, well, good news, we've kind of conquered this thing. Is it time to take the pedal, the foot off the gas? And it's because of those measures that that we're doing so well. So what can you tell us about what we still need to keep doing, Eric, and when are we going to see the other side of us?
Well, it is all very positive news in terms of the direction that we've been heading. But from my perspective, I cannot emphasize enough the importance of staying the course. We have to maintain physical distancing. It's difficult to remain at home for a long period of time. I understand that it may be difficult for many residents in Burlington. However, I'll coin the phrase from Jerry Maguire, and that is, help me, help you. And so you will help me and the hospital team by continuing to stay the course on physical distancing, not going out if you don't need to, ensuring that you're keeping yourself safe, washing your hands frequently, not touching your face. All of these measures that we've been doing for these past few weeks have had a profound and positive impact. The moment we let up could be the moment that we would see, potentially, to Dale's point, more new cases, an increase in spread. That could lead to another wave, so to speak, or a second wave. And I think this is also the message that we're hearing from the province. And I think it's very important that we stay the course and make sure that we have seen a reduction in the number of new cases. And then also, there's planning that has to happen in a very careful and mindful way about how we move to restoring our healthcare system in the sense of bringing back and doing elective cases and elective clinics. But that is still months out, and we will be given direction from the province as to when is the appropriate time to consider doing so.
Yeah, just to add to that, one of the campaigns that has just launched this week from our business community is stay home to get us back to work sooner, right? Yes. Exactly that message. Help us help you by not getting out there. And, I know the temptation for a lot of people, they're partly stir crazy. We all get that. But it's, businesses are losing money. They're not able to earn revenue. But the business community themselves are launching a campaign this week to reinforce that message that you actually help the economy in the long run by staying home in the short run. So I think, the good news is good news, but it's far too early to say that we have conquered COVID. We haven't yet.
Yes, and COVID is going to stay with us going forward. It's not something that's just going to disappear. We will be living and working in a COVID-19 world going forward, and it just may be to a much lesser extent. So I think it's important for all of us to start thinking about how we might be, as a society, living and behaving differently than we have in the past. We're 6 months away from the beginning of flu season, starting in the fall. And so we know that we have the regular influenza A, influenza B, other viruses, and in that potpourri, so to speak, will also be COVID-19. And so it's very important that we take a longer view, as important and as difficult it is now in the short term to be self-isolating and staying at home. A longer term view is what is going to get us through successfully.
Doctor, I know we hear from time to time about both Canadian and US as well as global researchers looking at a cure or a vaccination or something along the lines. Can you tell us anything about what you've heard and what activity is happening in those research areas? Some of it's quite close to home, I understand.
I sure can. And I mean, that's one of the exciting things about Burlington being where it is. So we're sandwiched between two of the largest research organizations for healthcare research in the country. So we at Brant are associated with some of the research groups at the University of Toronto and at McMaster University. And we're helping any way that we can in everything from clinical trials to research as much as we're able to. Now, there's a lot of talk in the media, especially internationally and locally, about research for vaccines and also research for therapies. Now, I can't speak too much with respect to vaccines, although I do know that there are a number of trials that are underway and a lot of potential, but recognizing we tend not to vaccinate against other coronaviruses. So there's a lot of research that's going into that, but we'll have to see in time the usefulness of those vaccines. If there's a vaccine that works, that is fantastic. But I think for the time being, where a lot of the research is, especially in this area, is into potential therapies. Now, we've seen a lot in the news, especially down south in the States, with respect to potential therapies being touted kind of as a silver bullet. And we just haven't found that yet. And the important thing to recognize is that medicine is built on research, medicine is built on evidence, and medicine is built on what we know will help people more than any harm that might come out of it. And that's part of the difficulty with this novel virus, is that because everything is so new, there are there's a rapidity and a speed that this research is coming out. And some of it is being lauded as the be-all, end-all much earlier than it should be. And I think this is the time that we need to continue to keep our critical hats on and make sure that we are treating people based on what we know will work and what we're seeing in new evidence and with rigorous research. So we are trying, we're working on that, both in a grander sense, but also at Brant. And I'm hoping that we'll be able to see some improvements in the way that we're able to treat all patients, including COVID patients.
I want to pick up on something you said, that we don't normally vaccinate for coronaviruses, and COVID-19 is just the latest iteration, of course, named for the year in which we discovered it. So I want to pick up on that because, I think there's a view out there that the coronavirus is a type of flu, and everybody knows that we have flu vaccinations. So tell us about this whole sector that's called these novel coronaviruses, of which this is just one, and how we normally would be treating them.
Yeah, and I think that's a very interesting point. And if you'll allow me to I suppose be a little nerdy for a little while. I mean, there's lots and lots of respiratory viruses out there. Coronaviruses are just one. Flus being another. There's rhinovirus. There's a lot of different things that can cause what we call an influenza-like illness. And that's part of the difficulty, is they do tend to rear their ugly heads in flu and cold season, kind of in the winter months. And coronaviruses, by and large, are like that. The vast majority of coronaviruses actually cause a cold. But then there's that other subset of coronaviruses that cause very severe respiratory disease. And so far, we have 3 that we know of. And that's SARS, MERS, the Middle Eastern respiratory virus, and now COVID-19. And the difficulty is that those 3 act very similarly in terms of the severity of disease. And that really contrasts with the rest of coronaviruses, which tend to just give you a cold. Now, the difficulty is we don't have vaccines to SARS or to MERS, for instance. But given the different level of the disease spread with COVID-19, there's a lot more of a push to be able to get it under control. But as Eric mentioned, this is not going to be the same situation as it was with SARS. SARS 17, 18 years ago now was much more closely monitored and fortunately was able to be stopped. But because of how widespread COVID-19 is now, I don't know that that's going to be possible, and it certainly isn't going to be possible for a very long time going forward. So if we can do anything, say, in the upcoming flu and cold season to decrease the number or volume of people that are coming through because of COVID and because of other respiratory viruses, we need to be able to do that. And one of the best things to do really is vaccinating against the flu. And our vaccine rates generally tend to hover around 20%. And we can do much better than that. And that's not just for the flu, but recognizing that that's going to allow us in the healthcare system take care of people as well as possible. And like I always say, get vaccinated for the flu in the inter-Thanksgiving period. So between Canadian and American Thanksgiving, it's a perfect time to get it done.
Well, thank you for that. That's shocking, 20% of vaccinations. I know that, in schools, there are certain things that you can't come back to school for unless your child is vaccinated for them. And, to your point, Eric, I'm wondering if you want to expand on things that you think might be different in the post-COVID world. I'm wondering if that might be one of them, but there may be, that we require flu shots before you can. I don't know if the hospital has a policy that your healthcare workers have to have flu shots, but you can speak to that certainly. But what do you think is also going to change in healthcare post-COVID?
Well, I think it's a great question. I think there'll be many changes, and ones that are going to hit home the most for within the hospital is our practices, how we're going to be doing our work. So if we forward, let's say 3 months and say we're going to start moving back into elective clinics and elective surgeries, we're just not going to move back into the hospital and resume our work like we did prior to COVID-19. So we have to redesign a lot of our processes, a lot of our practices to ensure that we're keeping our staff and physicians safe, keeping our patients safe, because COVID-19 will still be in the environment, exterior to the hospital, in the community, and can come into the hospital. So I liken it to the work that we have to do is quite extraordinary in terms of replanning how we do our business. And I think that analogy will also be very applicable to other businesses. And we're seeing some retooling now. The grocery industry is probably a great example, right? The times that we're going to be all communal in the grocery store, I don't think that's going to happen very much in the future. I think the new model would be one of kind of the grocery gateway model. You're going to place your order, it's going to be delivered to you, and you're not going to be browsing the aisles anymore, squeezing the melons. Those days are gone. So I think that those are examples of maintaining physical distancing. I think is a key principle that's going to be going forward. Hygiene. You mentioned vaccination rates. No hospitals have a mandatory vaccination policy. It is a voluntary adoption by healthcare workers and physicians. And so really educating people more about the benefits of the vaccination. And I think given COVID-19, I'm hopeful that we will see an increase in people voluntarily getting vaccinated.
Well, I too am a silver lining person. I think there's going to be a lot of good things that come out of this. And I rarely go to the grocery store because I can't get in for an item without being there for an hour. So I end up doing a lot of constituent work. So folks know that I've had delivery of things to my house for a very long time, unless we run out. So just in our last couple of minutes, I did want to ask you, Doctor, some of the common questions that I know you've heard, that I've heard. So number one that seems to be coming up is, do people need to wear a mask when they go out?
If you think that you are going to be unable to keep that 2 meter, 6 foot distance away from people and you're sick, then yes, you should be wearing a mask. But really outside of that, the most important thing that you can do to help prevent the spread of the virus is by keeping 2 meters away from people and washing your hands. The risk with wearing masks is that sometimes it lets our guard down and lets us get closer to people than we really should be. The evidence to suggest that masks prevent you from getting the infection is actually quite low. So that's why we haven't mandated it.
Another question I get a lot is, if somebody sneezes and they have it, can it stay in the air if I'm walking by a couple of minutes later? So we get that question a lot because there's lots of people walking. They keep their 6-foot distance, but are they at risk of somebody who walked ahead of them?
So the virus cannot stay in the air for any notable length of time. If you sneeze or if you cough, it falls to the ground, and it falls to the ground in that kind of 1 to 2 meter radius, which is what's defined that distance that we stay away from other people. It does not stay in the air.
That is good news. Well, we are just at the end of our time. I really want to thank you, Dr. Dale Kalina, the Medical Director of Infectious Diseases at Joseph Brant Hospital, for joining us and sharing your vast medical knowledge on this. Always a pleasure to talk with you. And you've been so generous with your time on both of our town halls, sitting on the first 2 of our task force meetings. So I really want to thank you for being so accessible to the community. Of course, always good to talk with you, Eric, Eric Vandewall, who is the president and CEO of Joseph Brant Hospital, has made yourself available to answer all questions about the community in the hospital. And I also want to really thank you for being accessible, for being transparent, and being on the show today. So thanks to all of you out there for tuning in to our newfangled show, remotely done via Skype. Thank you. Every Friday night at 7 p.m. we will bring you a new installment of Burlington Matters. I'm Marianne Mead Ward, Mayor of the City of Burlington. Stay healthy, stay safe, stay 6 feet apart, and have a happy April.